I gave an update actually to the treatment of pediatric Hodgkin's lymphoma, and I tried to summarize previous objectives and actual and contemporaneous objectives for the treatment in pediatric Hodgkin's lymphoma. It is a highly curable disease in children and adults, and the focus lies no more in efficacy of those treatments, but also on the reduction of late effects, namely radiotherapy-induced second cancers and also cardiovascular disease. This is are late effects that those survivors are going to suffer from. So our aim as pediatric doctors lies in in these fields to find cures for children without giving them late effects sequelae in their later life. Currently, most of the trials are still relying on combined modality treatment, namely chemotherapy plus radiotherapy, but there has always been an effort to reduce or to probably completely eliminate radiotherapy. And this has been focused on in several large collaborative groups, like in the North American groups, also in the Latin and South American groups, as well as in the European groups. Only very recently, I must say about 10 years ago, a European network had been formed among the European national groups for treating Hodgkin's disease in children and adolescents. And this was the aim to focus on radiotherapy elimination and to find dose-dense chemotherapy regimen for always better defining cures for those populations. One of the new strategies is to perform response adaptation according to metabolic response. That is not very new in Hodgkin's lymphoma, but it entered the pediatric trials quite late because with the high efficacy, large numbers of patients are needed to show the proof of principle, to show that these results can be used for a large population of children with Hodgkin's lymphoma. And the response assessment after 2 cycles, that's now been mainly a mainstay in most of the collaborative trials, namely the European Network of Pediatric Hodgkin's Lymphoma now saved radiotherapy upon this concept for 50% of all children, whereas in the previous trials most of the majority of the patients, about 85% or more, had been irradiated. So the hope is that with refinement of these techniques, ever more patients can be treated without radiotherapy, but in the end it will probably need more intensive and more dose-dense chemotherapy cycle to compensate for the loss of treatment burden of radiotherapy. It would be really an achievement to eliminate also the late effects of chemotherapy, but if you will, we have to balance the high cure rates with lowering the radiotherapy rates, but then we have also to give more treatment burden, and the hope will lie in new agents that are less toxic and equally effective, so that by time these the drugs, the old-fashioned, let's say, chemotherapy drugs, can probably be exchanged by new agents. Hope is lying in cancer immunotherapy, which has recently emerged and had produced exciting results. Especially on Hodgkin's lymphoma, there are for instance, the PD-1 receptor is highly distributed, and so this needs to be studied. But yeah, it will take time because the pediatric population is of course low, and it has to be studied in relapsed cohorts first. So it will take time, but this is a great hope. Our focus, like in many other cancer treatments, is we have to spend more effort on finding individualized risk factors, then finding individualized treatments, and to harmonize our risk stratification criteria. That will be the future for treating children and adolescents with Hodgkin's lymphoma.